So as a peer support worker, we're someone with lived experience of mental health, and we've got on our own kind of journey in recovery. We've been into different services, and we use that experience along with training that we've received via the NHS to provide people with hope within their own recovery, support them through empathy and understanding about the situation that they're in, and kind of walking alongside them in their own journey and just providing that support for them.
We have started to use the care plan, which has been co-produced, and within the care plan we start to look at just kind of getting to know one another, getting to understand kind of what the patient would like to get out of having peer support, and we can kind of explain a little bit more about what we can offer.
I think it helps because where you've got the sections, so it highlights, you can kind of discuss their strengths, which really helps people to kind of identify, because sometimes that could be a bit of people think negatively about themselves sometimes. So we use goal-based outcome measures so that we can record how they're doing within each goal. So you'll use those at the end of each session to kind of see how they're doing and working towards them, and it really helps.
I definitely think it's a great tool to reflect back on the work that you have done from when you started at the beginning working with somebody to when you've come to the end. I think sometimes they don't see the journey that they've come on, and they don't see how far they've come. But actually, once you've used a care plan, and previously I have gone back through the care plan and said, look, this is where we started and this is what you've achieved. And actually them having that realisation that they've achieved that much, you can just see how proud they are of themselves, of being able to be that open and be able to kind of overcome what they've been going through. So it's definitely been really helpful.
We're sort of opening up what was quite a closed service into something that's more accessible and has less stigma attached to it.
It's really unique, I think, because I don't think there's anything that I'd have known of when I needed support with my mental health that you could just drop in and speak to somebody, and kind of just walking down your high street doing your shopping, and it reduces that stigma of mental health because it's right there on your doorstep.
Yes, well, it's been an interesting role because it's about responding to people who come through the door for the drop-in, or if you're working with someone one-to-one, just hearing very carefully what they're saying and trying to respond to what they need. I have two levels of reaction to it. One is excitement, that you don't know who's going to walk through the door for the drop-ins, and so you have to cope. You have to be yourself but cope. And the other thing is it's quite scary, I have to be honest, because of course people are upset, they're homeless, they're angry, all sorts of things are going on in their heads. And I think it's our skill to be able to hold that.
One of the challenges was like walking through the door, the first point. But I have noticed, like, when one person walks through, it seems to encourage everyone else to walk through. And we've had quite busy moments in the drop-in, and people can walk in with a wide range of issues that they've got going on. And we, as a team, try to hold that space for them.
You can just walk in, there is no appointment needed. There is someone just to sit there, to listen, to offer support and some empathy. I think it's been amazing. I think it being on the high street for anyone just to walk through whenever they need it has just been, I think it's been really, really good.
At the moment we've developed 4 peer-led groups, including Rosemary's writing group, my craft group, the men's group and a carers group. So as I said, I'm the facilitator of the craft group, which consists of creative workshops from painting and drawing to textiles such as crochet, and open sessions as well, where people can bring their own work or use the materials in the hub. The whole idea around the craft group is the link between mental health and creativity.
I did create a men's support group, which has been running since November 2023, and it's got quite a few regular people who attend. And the idea of it was to normalise talking about mental health for guys, offering them a space to, you know, come and talk and mix with other people, and we explore the whole concept of mental health and what it actually means to them. You know, and one of the guys actually said he wouldn't know where he would be without attending. You know, so it has a massive impact.
A carers group is going to be more like a carers drop-in service or a family service that people can drop in if they are supporting someone with a mental health issue. The benefit of it will just give the carer that time just to come and have a chat with somebody, just so they're not feeling so alone, so they can just get the support that they might need.
To actually have a base now, a hub where people can actually come, it's been amazing, like to be part of that and help create that. And you know, such an amazing team to work with. You know, I'm thankful I'm be myself, you know, and I feel like I'm where I'm supposed to be.
I think it's just been nice that we from the start have had the involvement, and there's never been a moment where someone's kind of gone, no, I don't think that's a good idea. Everyone's always had the time and the effort to kind of listen to any ideas that we have had or any thoughts we've had or anything we think actually that might be beneficial, because that's maybe something that I've been through and obviously our lived experience, for them to go, actually that sounds like a really good idea.
And it's so lovely to have seen it grow and shaped and be a part of that.